Don't leave it at home. The epinephrine is not useful to you if you are not carrying it. So carry it. Figure out a device that works for you. So if you remember the AviQ or the Neffy or the anafilm that comes out, like whatever you're going to carry, figure it out.
Welcome to the Don't Feed the Fear podcast, where we dive into the complex world of food allergy anxiety. I'm your host, Dr. Amanda Whitehouse, food allergy anxiety psychologist and food allergy mom. Whether you're dealing with allergies yourself or supporting someone who is, join us for an empathetic and informative journey toward food allergy calm and confidence. I cannot wait to share with you my first guest in a new season of episodes that I've been working so hard on to address something that many of us are feeling deeply right now in the food allergy community. We are in the thick of both the excitement and the overwhelm that comes with how quickly the food allergy landscape is changing. Suddenly, there are more options, more devices, more information, more treatments, more opinions. And while all of that progress is absolutely exciting and hopeful, it can also leave us feeling unsure of what to trust, what to decide, what actually matters, and how to make our decisions in a way that feels grounded and not reactive. So my guest today is Dr. Farah Khan, a board-certified allergist at Nationwide Children's Hospital, but most of you know her because she has become a trusted voice online for so many in our community. Dr. Khan told me that she's not quite sure why her audience grew so quickly and why people are resonating with her voice, but I think I know why. In a time when everything feels uncertain and overcomplicated, she offers something that many of us are craving, which is clear, direct, evidence-based answers. I asked her to join me today to talk about epinephrine options, the different devices that are available, how they differ, the common myths and misinformation, and why hesitation and second guessing can be dangerous. Dr. Khan helps us to simplify something that has started to feel so complicated and help you feel confident and less overwhelmed as you navigate your epinephrine options. Dr. Khan, thank you so much for being here on the Don't Feed the Fear podcast. I'm excited to have you.
I'm so excited to be here.
Well, I would love it if you would start just by giving us the story of how you ended up in medicine and then in allergy and then now on social media chatting with all of us.
Yeah. I think most of it was accidental. So I always knew I wanted to be a doctor because of a simple thing that has sort of carried with me, even after all these years of training and working, which is I just want to help people. I want to be able to give back to my local community. I just want to be able to help people. And then in medical school, when you're doing all these rotations and stuff, I really loved general surgery. And then I really loved pediatrics. I mean, they are on total ends of the spectrum with very different trainings and very different lifestyles after you're done with training. So I actually applied to both and interviewed for general surgery residency and pediatrics because of lots of life things going on and sort of big picture goals that I wanted to be able to accomplish. I ended up ranking pediatrics as my top specialty. And I matched up my top program and went on to do pediatrics, which I really, really loved. But it wasn't the cute babies that like brought me into the specialty. Like I didn't know that I wanted to work with the cute babies. It was teenagers that I just really, really loved working with. And then in residency, when you're doing just general pediatrics training and you're getting a flavor of like whether or not you're going to subspecialize, I really loved everything. I loved the NICU. I didn't love the PICU because I didn't love the call. And it was also very, very sad and depressing to work there. But I loved everything else, GI and cardiology. And then one of my senior residents, who's still a very dear friend of mine, said, why don't you do a rotation with our allergist? She's fabulous. And so I just happened to do the rotation and she was so happy all the time. She's still so happy all the time. I just saw her at our annual meeting and I had a little chat with her and I was like, goodness gracious, like, how do I be more like you? You're the one who inspired me to go into this specialty. And I think it was because she just really loves working with this patient population. We're dealing with a lot of chronic medical conditions. We're dealing with a lot of figuring out how to access care and medications and getting people to speed and stuff. I just loved it. And I don't regret for even a second going into allergy and immunology. And now I've been leveraging like what I do in clinic and kind of trying to have a bigger impact. Some of my friends who are also physicians who are on social media, we always say like in clinic or in the ER room or in the hospital room, we make a difference one patient at a time, one family at a time. So even if I can reach like 12 people or 200 people, like that's kind of crazy. So trying to channel the power of social media into some good. So that was a very long-winded answer, but I just wanted to help people, and that's basically why I'm on social media.
And from a couple to 100 to now many, many thousands of people. I mean, your account just grew so quickly from when I found you to where it is now.
Yeah, I didn't even realize I was like making these, like reaching these benchmarks and these milestones. It was other friends that were like, "Oh my gosh," like cheerleaders, like, "You just reached 5,000, you just reached 10,000," which has been really exciting. So it's been kind of crazy, and I've been able to meet people that I would have never ever met, like you, right? Like, when would our paths have ever collided? Even though we do work that like really kind of goes hand in hand.
For that purpose, it's just so amazing how far you can reach and who you can connect with and get conversations going.
Yeah, absolutely. Absolutely. So I have like a love-hate relationship with social media in general. I think most of us probably do. But on the good days, where parents will message me and say like, "Oh my gosh, we got a second opinion," or "We did a food challenge," or "Oh, we passed this," or "Oh, we outgrew this allergy." That's so wonderful. Like, it just like amplifies what I'm doing in clinic as well. So good days and bad days, but more good than bad.
Well, and it's funny that you mentioned that. I didn't know this about you before, but that you say you were interested in surgery, because from the little that I know about the different aspects of medicine, you seem like you kind of have that approach. Like, you could be a surgeon. Like, you're really you can be really matter of fact. I know you've gotten some jokes online about sometimes how spicy you can be about it, but that I can see that. I can see you in that role.
Yes. I mean, that's why I loved it, right? It's like, it's also like in the OR for the most part, like, yes, the anatomy can vary, but it's like black and white. Like, you know what you're doing and you have expectations, and there's just like a sequence of events that need to happen. Allergy is really interesting because it's not that at all. Like, everybody's story is a little bit different. Everybody's symptoms are a little bit different. Everybody's like treatment option is a little bit different. But yes, so, and in real life, I joke about this, but it's like not really a joke. Like, I'm pretty like matter of fact, and like I'm spicy and sassy in real life too. So what people get online is how I am in real life too.
Well, and obviously a lot of people are drawn to that. There's something about that approach that's different from other people. Like Dr. Reeland has such a soft approach and people love her account. And then you have a totally different vibe that people are drawn to. What do you think it is that people are resonating with so much that you're sharing?
I'm going to be completely honest. I'm not sure. I don't know. I don't know like what chord I'm striking, other than being able to just talk about like some of the drawbacks and some of the nuance and some of the I don't know, and I'm not sure, and being able to admit that openly. I don't know. I will say that I love me some Manisha, love Dr. Ray. And when we co-presented at another conference where I got to meet you in real life, it's so interesting because I think we need people like her that are like soft and caring and just so wonderful on so many levels. And then you got to have some jerks like me that are going to be like, but wait a second, and to call it out a little bit. So it's. I don't know what chord I'm striking. If people want to send me a message, like if you want to tell me like what it is, it's striking a chord, I should like turn that up a little bit.
The time that I found you was the picture of you in the t-shirt that says use the dang epi. And so that's when I was like, we should do an epinephrine episode together. What do you think? What was it about that? Like, tell me what your mindset was in posting that.
Yeah, so it's interesting. When I started on social media, it was literally because I wanted people to just stop telling moms to cut out a bunch of foods from their diet if they were breastfeeding to try to control like eczema or manage a food allergy in their young baby. And like to stop ordering like broad food allergy panel testing in young kids and stuff. So I just wanted to be able to like shout that from the rooftops. So when I started, I was probably a little bit more conservative. Like, I was just nicer in my delivery, and maybe people miss that. And then over time, I realized like the stuff that I say in clinic is the stuff that I want to say online. So I think my patients and families still probably get an even more direct answer in clinic because I can do that, right? Like, if they tell me about a program or a supplement or like, oh, I heard this, I can just tell them like, no, that's crazy, or no, don't do that, right? But I can't necessarily bring that same vibe online. So that's sort of the little bit of distinction.
Well, in clinic, you're their doctor. You literally, it's your job to give them medical advice, and you have to tiptoe around that online too, right? So what not to do, but
Yes.
also do this, like definitely do this.
Yes, yes. And then what I realized is that like a lot of the recurring themes in clinic, like people are like, oh my God, you only use the epinephrine if you are having trouble breathing. And I'm like, if y'all are waiting until you're having trouble breathing, we have made some left turns. We are not going in the direction we need to. And so it's just really funny. Like the one post that has continued to just go viral. Like the last I checked, it had like a few 100,000 views, which is a lot for me because I'm in a small corner of the internet. It was that, which is like, don't wait to stop breathing. Like that's not it.
Mhm. And it takes so much repeated messaging. And as we said, I think from different angles, different voices to override some of those things that just linger. Did that actually used to be the medical advice, or is that kind of a misinformation that all along that you don't epi until it's a breathing issue, or it's not anaphylaxis if it's breathing?
I think allergists have probably had a better understanding of anaphylaxis because this is just what we do for a living. This is what we read about. This is what we're researching. This is like what the risk is of a lot of the conditions that we manage. But I think, unfortunately, I don't know when it happened, but it just started like that was the thing that sort of came about, which is you don't use the epinephrine unless you're having trouble breathing. And I still have patients and families that come to me and they were like, we were shamed by the EMS guys, or we were shamed by the ER providers or the staff or whatever, because we used epinephrine. And then by the time we got into the ER and the doc got by the bedside, all of our symptoms had resolved. And they were like, well, that was an overreaction. And it's sad that that still exists, right? But they got better because they did the right thing. They used the emergency
Right. That's why they looked
epinephrine.
so great by the time they got there, or by the time they were seen. My sister had a friend just the other day who's an adult with food allergies, and she ordered a cranberry muffin. It accidentally had blueberries in it. She's allergic. She's the thing we hear all the time that makes us cringe. She took a bunch of Benadryl and she went and slept it off. And she said the same question. You mean I should epi even if I'm not having trouble breathing? And I was like, yes, yes, yeah. And then I'm
Yeah.
not a doctor, but I'm trying to share all of you who are saying this over and over so we can get through this hesitation that people have. What else are you hearing as far as people being so afraid to use it?
There's a couple things. So I think for me, what I keep in mind is the unpredictability of allergic reactions and anaphylaxis, right? So some people will just have hives and it won't progress to anything else, but there isn't a skin test or a lab test or a magic 8 ball that I can use that can help me predict, like, that's it. That's all you're going to have. It's some hives. It's going to get better with some oral antihistamines like Zyrtec or Claritin or something like that. And we always want people to err on the side of caution. So if you start to like have a tickle in your throat and maybe you have like a cough and now you're breaking out in a rash, that's two systems. Just use your epinephrine. You're never going to be wrong to use it. So I think people underestimate allergic reactions, or they're really nervous and they're just like, well, if I have to use the epinephrine, then I'm going to have to call 911 or I'm going to have to go to the emergency room. And I think most of us, unless we need it, like we kind of hesitate to seek emergency care services, or some of us, right? Like we're not, we don't want to end up in the ER. We don't want to go to the urgent care. What I tell patients is if you use it and your symptoms get better, call us, right? Let us know so we can like do an assessment and keep you out of the ER. Like I don't want to send you to the ER either, but if you don't use it, that's where you might end up.
Have you seen that help people be less hesitant now that that recommendation has officially changed, that you don't necessarily have to call 911 and go if your symptoms resolve?
Yeah, so we saw this big shift with the pandemic, right, where we were trying to keep people out of the ER and urgent cares and stuff. And this guideline of like use the epinephrine and go to the ER or call 911 is almost exclusively an American guideline. So our counterparts in Canada and other countries internationally haven't necessarily always had that. So again, it takes time to like get people on board with this. So I will tell you, I have even met other allergists and healthcare professionals that don't feel comfortable saying, don't go to the ER. You're not like having even a risk benefit discussion with the family, which I think is a disservice, right, to that family, because I don't want them to be in a position where they're scared to use it because they're going to have to go to the ER. And then the big classic one that everybody hears is like, oh, I don't want to have to poke my kid because they think it's like a giant 6-inch needle that you're going to have to jab into your thigh, and it's not. It's not. But I still hear that too. Like, oh, I don't want to have to like stick my kid.
Right.
or stick
Which
myself.
makes me think, you can tell me if you think this is true in your experience, but I wonder if those are the people who haven't seen the anaphylaxis in action yet. Because once I saw how bad it could get in my kid, there was never any hesitation again. Like, I'm sorry if this hurts, but I will not hesitate to prevent that from happening. And then the kids experience how,
Yeah.
or adults, how much better they feel so quickly. I feel like that melts away that hesitation. Do you think so too?
Yes, yes, that's definitely what we hear from parents and older kids and teenagers in clinic if we're doing a food challenge and we're trying to either like start them on oral immunotherapy or we're trying to figure out like have you outgrown this, if they develop any symptoms and we need to use the epinephrine. I don't think I've ever heard from a parent that they feel bad about having had to use it in a monitored setting. Almost always what I hear after some tears and scared and nervous feelings that bubble up during the acute reaction is, oh my gosh, that worked so quickly, especially in young toddlers when they're fussy and inconsolable and crying and they're breaking out in hives and they look miserable. And then you give them the epinephrine and within a couple of minutes, symptoms start to reverse. Like, I think that also has empowered other teenagers, patients, and parents and caregivers to just use the dang epi if they find themselves in that position again. And just hearing that from them makes the entire experience worth it for me as an allergist. Like, I gave you the information, we walked through this, and you guys were able to do the right thing.
For the millionth time on my show and everywhere else in every corner of the internet, it doesn't hurt you if you epied and it turns out you didn't need it, correct?
Right. Okay. Right. Because it's you make epinephrine, right? So you can't be allergic to it. If you're on certain medications or have like cardiac conditions and stuff, sometimes we want to caution a little bit. But again, that needs to be a very specific conversation for the meds that you're on, your past previous medical history and things like that with your allergist to get a risk assessment for you. You can't take like a risk assessment that I've done on a 16-year-old totally healthy teenager and then apply it to a 52-year-old man with hypertension, diabetes, and heart disease, right? Like that's not it.
Yeah, not applicable across the board. But
No, different risk.
but that, I mean, if someone's giving you a prescription for it, that's the conversation to be having for them, right? And they wouldn't have prescribed it if they didn't feel that the risk was appropriate if there's a chance that it's anaphylaxis.
Correct. So we still use epinephrine even if you are on certain medications like beta blockers, which are often used in hypertension management. But sometimes we may need to reach for a different medication called glucagon if you end up in the ER and you're just not as responsive as we would have thought or hoped with the initial epinephrine.
Where I spend a lot of time, obviously, is working with families and this balance that you touched on. Like, we get shamed if we react and we treat and we go to the ER, but we feel like we're shamed and guilted if we don't use it. And I feel like there's always this really precious balance that families are stuck trying to strike. So what's your perspective on how they find that?
Exactly what you said. Like, it feels like you're oscillating between shame and a little bit of embarrassment. Like, oh my gosh, my kid had an accidental exposure on my watch at the birthday party, right? And just being really scared and then having a lot of noise, right? They're getting maybe like some information from their allergist in their allergy office, but then maybe they found like a friend or a neighbor or a support group and they're hearing something a little bit different. And then they're looking for their own information online. And there's lots of noise online around epinephrine, right? And depending on who your source is, like sometimes the way that I talk about allergic reactions and epinephrine and using it is very different from an ER provider. Right. And then parents and caregivers and patients have to be the ones that like reconcile the differences. And because you're usually not seeing your allergist every 2 weeks just to check in to be like, hey, how's it going? Right. All of those questions and like the small things don't always get addressed. And then when you have your, every 6 month or every year evaluation, not everything gets touched on that you have consumed. And so then you're stuck navigating all this information.
Yeah. And there's a lot of that swirling around in our heads. Everyone says don't play Dr. Google, but at the same time, we're looking for information. We are just desperate to know. We want answers. So it is tricky.
It is very, very tricky. What I try to do in clinic when I hear this from families and parents is like, oh my gosh, the EMS guys said we should not have given epi, or the ER provider said we should not. I'm just like, they were wrong. right? Like, period, end of sentence. It's black and white for me because your kid got better. It doesn't matter if the hives were faint or it was just one episode of vomiting, right? And I think sometimes hearing that in black and white at least helps them to be able to navigate and go forth to do the rest of the hard work. But it's really hard, and it always makes me, it really kind of pisses me off when parents come in and tell me that they got shamed for using freaking epinephrine. Like, that's not okay. We need to do better. That's also why I'm online, right? To help raise awareness, because there shouldn't be this big discrepancy between what the allergist is saying and what the ER doc is saying. There just shouldn't be.
Thank you for saying that. I mean, I can't complain. We've had amazing emergency workers every time, good job, mom, patting me on the back. But for the people who don't hear that from their own providers, I think it'll be helpful for them to hear it for you, because we're from you. We're just doing the best we can. I'm so emotional. I'm jumbling up my words. We need to hear that. When I became an allergy mom, there's two types of injectors. There's an EpiPen and a generic, and you avoid, and that's it. And now, I'm thrust into this world along with all the other parents of an abundance of options, which is amazing and so overwhelming and so stressful. So much guilt about, do I choose it? Do I not? We're talking about all those options, but I think the biggest and the most important one is the epinephrine options. So tell me about what the patients you're working with are saying now that they have to choose, and what they're carrying, and how you're guiding them through that.
Yeah. I think it's so exciting that we even have options, right? The fact that we only had a generic epi and an EpiPen for a really long time. And then, do you remember, was that like 5 to 10 years ago when the kits were costing like $600 or something insane?
Yep. So I've $700 it was for us with insurance to get a pair of EpiPens. It's still for me $400 with my health insurance to get a pack. Yeah. It's ridiculous.
It is so ridiculous, especially because the medicine itself is like $1. It is $1. Okay. So we've come a way. I'm not even going to say a long way. But the fact that we have like something like AviQ, which the device shape is a little bit different. Sometimes teenagers feel a little bit more comfortable and more inclined to carry it, right? Your epi is useless if it's not actually with you. And then now the intranasal epinephrine, which is also super exciting. And then the sublingual epinephrine from Aquestive. I'm super excited about that too. I think change is hard for everybody, especially in medicine. Like, we tend to be a very conservative bunch of people. Like, we are not cowboys. We want to know, like, study after study after study after study and decade after decade of experience. That is traditionally what we have responded to. And it's very hard to like take something new and be like, oh, okay, yeah, like, okay, you want me to, there are still allergists even that are hesitant about prescribing the intranasal epinephrine. Some of them just straight up won't, and some of them have sort of come up with a plan, like still carry your traditional auto injector and have the as a backup, and then have the intranasal, right? So people are like finagling some treatment plans, and it's not just providers that are hesitant, it's also families that are hesitant, right? They're like, what? You just put it up your nose? Like, some of it is, oh my gosh, you don't have to stick my kid with a needle. And then some of it is like, wait, what now? Are you sure it works? How do you know it's not going to dribble out? What if he's sick? What if he's congested, right? Even though we have data.
We're going to think of every possible. Yep.
We are, right? And it's not that, and I'm not like shaming asking questions, because I had all those questions too, right? And I think what's important is that our ability to pivot and start to incorporate that stuff, and then to follow it after it hits the market, right? Like, what are we going to learn over the next few years from Neffy, the intranasal epinephrine? We're going to learn a lot. And just having that option. And I will say that the biggest driver right now for me in clinic on how I prescribe, unfortunately, is cost. So what's insurance going to cover? And for some people, even with the patient assistance program for the intranasal, like, it's still a couple $100. And I do tell them, like, there's a little bit of a trade-off, right? It has a longer shelf life, the intranasal. It doesn't just expire automatically after a year. It's 2.5 years. I think it's 24 plus 6, 30 months.
Good math.
Do some math. So there's a little bit of a trade-off, and then depending on sort of what they feel comfortable with. And if my teenagers are more inclined to just carry the intranasal epinephrine device because it's not bulky, it's super, super light. A teenage girl can throw it in her purse, or the kid, like any of them, can just throw it in their backpack. And if they're more likely to carry it, I think that's a big win, guys.
I agree. I agree. You said it already. The epi that works the best is the one that you're going to carry and use, right?
Yes. Yes, exactly.
One of the hesitations that I hear the most that I don't feel qualified to explain, even though I read all the studies, but I think people need to hear this over and over. Parents are saying, but I read, this is mostly for the Neffy, but it's coming up with Anafilm too. But I read that they didn't actually test it on people who were having anaphylaxis. So could you please explain why that is the case?
Yeah, so we don't have any studies, even with the traditional injectors, because it is not ethical to induce anaphylaxis. So this is why it becomes really important to monitor these devices after they hit the market, once we start prescribing them, and seeing how this plays out in real life scenarios. The studies that we have simulate what epinephrine is supposed to do. And what we have seen even with the intranasal stuff is that your blood pressure rises, your heart rate rises, your blood pressure even rises a little bit better than like the traditional subcutaneous auto-injectors. So it's reassuring, but there's never going to be a study where you're like, hey, you're allergic to peanut, come in and eat this peanut on purpose so I can see what anaphylaxis looks like and whether or not you're going to respond to the intranasal Neffy. Like that's just not how we do clinical studies anymore in clinical trials.
But it's well established that epinephrine works, and it's well established that the amount of epinephrine in the system is occurring regardless of these modes of delivery, right? That's bottom line.
Yes, yes, yes. And I just think it's so interesting, right? The way that it gets delivered, whether it's a shot or it's like dissolving under your tongue potentially, or like a spray in your nose. Like, how cool is that, right? Like, how far have we come? So yes, people are nervous, but also like, wow, how cool is this?
Well, and correct me if I'm wrong, but is it the next level now where in clinic, if at a food challenge someone goes into anaphylaxis, you're recording the data?
Yes. So now that Neffy is on the market and it's available and we can prescribe it, now there are some centers that are using it in their food challenges that we are challenging anyway, right? We think you've outgrown it, you're coming in anyway, and then if you have anaphylaxis and you need epinephrine, then we can figure out the Neffy or the traditional and then compare those. So I think we're going to learn a ton, right? How incredibly informative, right?
More information is always better. Can you talk about your experience? Because what I'm hearing is a little bit confusing about people who are having those uncomfortable nasal symptoms with the Neffy.
So everything that we do has risks and benefits, right? Even when we get in the car, when we decide to cross the street. And that's the perspective that I try to keep. There are side effects even to something like Tylenol and Motrin. They're incredibly safe, but they have some potential side effects. So it's the same thing with the Neffy, unfortunately. The stinging, burning sensation that I've been hearing mostly from online, from parents who have had to use it, and then what their kids are telling them back. They've said it's been pretty intense. And then maybe a dozen people have reached out to me like, hey, have you heard any more about this? And maybe a couple of them were like, I don't think we would use this again because it was just not worth it. It lasted for several hours. It took until the next day. And then the rest were like, it stung and it burned, but he started to feel better from an allergic reaction standpoint. And then once he calmed down, everything kind of went away pretty quickly. So again, it's going to be a conversation with that patient, with that family, and then we decide. And I'm not trying to push Neffy. Like, I'm not sponsored by anybody. I should have said that.
Me neither.
So I just want people to use the device that they are most comfortable with. And if you're like, intranasal is way too new, or I've heard too many horror stories about it, that's fine. Just make sure you're having that conversation with your allergist as well so that they can come up with a plan that makes sense for you.
Yeah, I think it's going to hurt if you use an injector in your leg. So it's not necessarily like, what's wrong? Why is this hurting? We're just more accustomed to the idea of like a needle is going to cause some pain in your leg.
That's an excellent point. There is some injection site soreness, and sometimes it can last for until the next day or two, depending on like who jabs you, because people think you really do have to like jab somebody. And the pressure, you don't need to. You just need to apply enough pressure for it to click and then hold for 3 seconds. You don't need to jab people, but they do. And then you can end up with a little bruise at the site. So it is a trade-off.
Yeah,
That's a great point.
absolutely. We're recording this just before we're expecting it to be approved. But tell us a little bit more about Anafilm.
I'm not going to speculate too much. I'm super excited for them to like hit the market and for us to like see more data and get it into people's hands. I think what's interesting is somebody had asked me right before Neffy got released, Dr. Khan, don't you think everybody's going to convert to Neffy and everybody's going to feel way more comfortable using it? And look at this conversation we just had. Where we're like, people aren't using Neffy. And I had said even then, I was like, this is so great. Like, I am super excited for all the biotech advances within the world of allergy and stuff. So same thing with the Anafilm. But there are still going to be people that are like, I'm not sick enough. Like, oh, I just ate a piece of shrimp accidentally, or oh, I had a bite of that toast, even though I have a wheat allergy. I'm just going to like wait and see, right? And it's that part that I want to work on online and spread awareness. Like, it's okay if you have an accidental exposure. It is like, I'm an allergist. I have a food allergy. I've had multiple accidental exposures, not because somebody like made me. It's because of my own doing. Like we're allowed to have mistakes and to screw up a little bit as long as you know what to do if that should happen and you should have symptoms.
Do you experience that moment of hesitation too?
So I have a pine nut allergy, and the first exposure that I had back when I was in grad school, I had anaphylaxis, and I didn't even know what it was. To be honest, I thought it was like food poisoning, and I was like, why did I have all this vomiting and diarrhea? And like my roommate didn't, and I don't understand. And the next day I went to class and I was still beet red. That's sort of like a delayed skin reaction sometimes that happens when you have anaphylaxis, and you just end up looking like a lobster for a while because of all of the delayed chemicals and mediators. And I was beet red, and I am brown, okay? I am very, very brown. And I was walking around like a lobster, and she was like, what happened to you? Because I had the pesto, the pine nut pesto for dinner. And I was like, I think I got food poisoning. Like, I was just hugging my toilet all night. And she was like, I think you had an allergic reaction. And that was the first time I had even, like, it even was like, oh, is it a food allergy? And then I still didn't believe it. So I didn't avoid pine nuts because I didn't know any better. And then I had like a few other exposures in like a pasta or a pesto or something like that. And I was like, why does my throat always get scratchy when I have pesto? So it took a little while, okay? It took a little while. This is being in your 20s, okay? In your 20s, you are invincible.
And you know
like,
everything.
Nothing. And then as I got into like med school and training, I was like, oh my God, I think I have a pine nut allergy. So I avoid, but I have still had accidental exposures, usually in restaurants when it either like slips my mind because things are busy and chaotic and I forget to tell the waiter or waitress I have a pine nut allergy, and then like I get a salad or something that has some pesto on it. And the last time it happened was 3 years ago. I was having dinner by myself after a long interview day for the current job that I'm in. And I went downstairs to the hotel restaurant and I was like, I'm going to get this salad. It sounds so good. And then I forgot to tell the waitress, and it was an incredibly busy night, and she was like stretched and covering like 22,000 tables, that I had a pine nut allergy. So she brings out this salad and I have a couple of bites and I'm like, this is really good. Oh, but why is my throat scratchy?
No.
So I stopped eating, and my symptoms didn't progress to anything else. But that was just me, right? Like, I can't blame the waitress. I can't blame the restaurant. That was just me. I had an accidental exposure because it was me.
And it happens. And I think you made a good point. Like, there's no shame. Mistakes happen. That's why we have it.
Yeah.
That's why we always carry it. That's why we use it when we're in doubt. It's just always a risk.
Yeah. I didn't even know it was anaphylaxis the first time I had it. But now I do carry EpiPens or the generics or whatever auto injectors.
Hopefully you never have to use it. But if you do, I want to hear what you, the queen of use a dang Epi, like, I want to hear how it is for you.
Yes.
But
yes,
hopefully
I will.
that day
I
will never come. But
yes.
that touches on something I notice all the time, which is that it seems harder for adults to adjust or to even let it sink in that it's a reality. Not just that I'm invincible, I'm in my 20s, but older people often it's developing a shellfish allergy into their 30s, 40s, 50s. What's your take on that?
I think we're embarrassed. I think we were just really, really embarrassed. That's what it was for me the first few years after that big anaphylaxis. I was like, no, like I can't, like I don't want to go out to eat with my friends and like why should I be the one that has to like make this accommodation for this like stupid nut that's threatening my my allergy cells. So I was embarrassed for a really long time. And even my close friends didn't know that I had a pine nut allergy. And I don't think a lot of them found out until I started educating on social media. And I would like drop it in here and there, like, oh, I have a food allergy, or oh, I've had anaphylaxis before. They were like, what? We've gone out to eat with you 32 times. Like, are you serious? And I was like, yeah, I just wouldn't want to say anything. Now, I don't care. Like we'll travel internationally and I'll like look up the words that I need and have it like on my phone so I can like tell it in the native language to the waiter. And now like I don't care. But I was really embarrassed for a really long time. And I think that's what happens. Like people just don't want to make adjustments.
Well, yeah, and I think that's one of many barriers. I hope that hearing that, especially from you, I hope that alleviates some of that from people, because I think it's a natural response, because we don't like to feel different in any way. But obviously, you didn't do anything. You didn't ask for it. You didn't create it. It's not anything that anyone should be ashamed of. What do you want to sum up and leave them with in terms of epi decisions?
Just use the dang epi.
I knew you were going to say
don't leave it at home. Don't leave it at home. Like the epinephrine is not useful to you if you are not carrying it. So carry it, figure out a device that works for you. So if you remember the ABQ or the Neffy or the Anafilm that comes out, like whatever you're going to carry, figure it out. And if you're really, really nervous because maybe you have asthma or hypertension or just other things that you're also managing, please, please, please talk to your allergist about it. We want to know all of those nitty gritty details, including whether or not you can afford the epinephrine, whether or not you're moving, what are you stressed out with? Like, I need to know that information so that I can best take care of you. And I think even though we're constantly strapped for time, those are things that I absolutely need to know. And I think sometimes people hesitate because they're like, oh, well, I'm kind of embarrassed, or oh, maybe she doesn't have time. But that's the stuff that I just want you to tell, like up front when my nurse is rooming you and she's like doing vital signs, like tell her I can't afford the epi and XYZ's happened or my insurance denied it or something like that, because then that's stuff that I know up front. And I think most allergists would say that we want more information and more of the nitty gritty details.
I do think people are afraid. We don't want to annoy you. We don't want to go on and on. We don't want to ramble. That's, I think, very helpful to hear, to go into it, lead with that, make it a point so that you can help us.
Yes, because I won't know it's a problem until you tell me. And I never know what insurances are going to cover or what your plan is or what your deductible is, right? But if you tell me, then I have like parameters to work with it. And then we can figure out like a prior authorization or a different device.
Let's do the pros and cons of all of our different options. And as we said, Anafilm will be coming soon, so we'll include that. Pros and cons.
Yes. So I will say that the pro to all of these devices is that they are epinephrine.
Good point. Same medicine.
It's the same medicine. It's just the device that's a little bit different. So EpiPens, or even the generic equivalents, are the auto injectors. And what we mean by auto injectors is once you actually place on your thigh and have enough pressure, that activates the injection needle part to sort of pierce your skin and deliver the medication. Some people would argue that like when you get one kit and it has the two pens, it's kind of bulky, and so the teenager who's leaving the house to go to dinner, is he going to put that in his back pocket? Like, no, absolutely not. Which is also why I think parents butt heads with their kids if they're just flying out the door without like a jacket or a purse or something like that, because they're like, take your EpiPen. And they're like, but I don't want to. Where am I going to put it? So it's bulkier, but it's epinephrine. So if that works for you and your insurance covers it, great. And then AviQ is the other one. It looks more like a credit card shape. I wish it was as thin as the credit card. It still has maybe like half an inch,
maybe
like a centimeter or so, 3/4. So it still has a little bulk to it, but the idea with that one is that it actually talks to you. So once you activate it and take the top off, and then it tells you like inject it and how long to hold it. And sometimes people feel more comfortable with it because of the voice-activated instructions that come with it. The ABQ is also interesting because it comes in 3 different doses. So typically you have the regular generic EPIs are just 0.15 milligrams if you're less than 25 kilos. And then anybody above that and adults, it's 0.3. And even if you just have the adult dose, but you have like a 2-year-old who's having anaphylaxis and you've recognized the symptoms, there's no harm in just using the higher dose. But ABQ also has a really small dose, a 0.1 milligram dose for babies that are less than 15 kilos. You can use those, like, am I stressed out if you get the 0.1 milligram versus a 0.15 milligram? Not really. And sometimes because of the cost, sometimes I don't even prescribe the 0.1 milligrams because these young babies, like, they tend to grow and gain weight, and then they sort of like way out of the ABQ 0.1 milligrams. So if that feels comfortable for you and your insurance plan covers it, great, get that. And then the intranasal device, which we talked a lot about today, also comes in 2 different doses. And then the idea, even with that, is that in each kit, you get 2 of those intranasal devices. And it's basically like a squirt, like a mist up your nose. And if you need the second device, you should use it in the same nostril. Based off of what they found in the studies.
Perfect. And then Anafilm, which is coming soon.
Hopefully it's going to dissolve under your tongue. I'm kind of curious to see how they'll package it and how many strips are going to come in it. Is it just 2?
I think you'll get it in a pack of 2, but you get one little strip inside of each film that you fold over and peel open.
See,
like they've showed me, you put it like inside your phone case, totally flat, like Listerine strip size.
This is so wild. So wild. I love it.
It's going to be exciting. Well, I appreciate you laying that out because bottom line is they all work.
They all work. They're all epinephrine, guys.
Oh, thank you so much for taking the time to chat. This was amazing.
I was so excited to be here.
I love the way that Dr. Khan took something that feels so complicated and boiled it down to such a simple message for us. When emergencies happen, we don't rise to the level of information that we've skimmed. We fall back on what we truly understand and trust. Here are 3 action steps that you can take after listening to this episode. Number 1, just take a moment to get familiar with your specific epinephrine device. Whatever you carry, review how it works at a time when you're calm, practice with the trainer, review it with everybody who needs to know how to use it. Confidence is built before emergencies happen. Number 2, notice where your doubt is coming from. If you find yourself second-guessing epinephrine use or the type of device that you're carrying, ask yourself if this is based on medical guidance or on fear or misinformation. Clarity and awareness about that can reduce your hesitation and save your life in an emergency. Number 3, keep learning, but choose clarity over quantity. This whole season is going to be about navigating options without drowning in them. So follow educators and clinicians who are qualified, who are providing quality information, and who help you feel steadier, not more anxious. Dr. Khan is one of those voices, and if you haven't found her on social media yet, her account on Instagram is farah.khan.md, farah.khan.md. The link will be in the show notes. If this episode helped you to feel more confident or grounded, I'd love for you to share it with someone else who is also feeling overwhelmed or excited about epinephrine options. As always, a like, a review, a subscribe, all help the show to grow and reach more people. And thank you again to Dr. Khan for being such a great guest. The content of this podcast is for informational and educational purposes only and is not a substitute for professional medical or mental health advice, diagnosis, or treatment. If you have any questions about your own medical experience or mental health needs, please consult a professional. I'm Dr. Amanda Whitehouse. Thanks for joining me. And until we chat again, remember, don't feed fear.